Hi everyone, I'm Shamila Nasreen and I'm doing PhD from Queen Mary University of London under the supervision of Purver and presenting a rare class dialogue at tagging for Alzheimer's disease diagnosis. So Alzheimer is the most prevalent form of dementia and over 850,000 people in UK suffer from dementia. And normally the tests used are kind of neuropsychological tests and in-person screening tests. They are time consuming, stressful and expensive and require medical experts to interpret the results. So apart from the memory suffering problems, patients also have problems, commonly observed problems in language and changes in their behavior. So researchers are investigating either linguistic or language-based or interaction-based methods can help in devising non-invasive tests. So here is an example from a natural conversation dialogue where some questions are asked from the patients and patients are generating some kind of non-understanding or partial understanding signals here. Like in the second example, the interviewer or carer is asking a question, does he have any pictures of shark? And patient is saying, does he have any, indicating a partial understanding of the question. And the interviewer or carer is providing that particular bit of information. So the motivation is like the previous work on language-based analysis have good accuracies, but they are limited to specific task or domain. For example, clinical interviews are picture description tasks and very less interactive in nature. For example, dementia bank data set, and they are kind of monologue in nature. So then comes under conversation analysis studies. The conversation analysis studies although provides strong and rich cues in characterizing interaction differences in natural conversation of 80 patients, but they lack the computational modeling. So recently people are working on interaction in dialogues and looking for different pattern in daily life conversations or or either in clinical setting. So some of the people like Mehedi in 2019 worked on combining the lexical aspects of dialogue or interviews with the CA inspired features, but their approach is still their data contains structured interviews in more clinical settings with predefined topics and predefined questions related to memory problems. So what's the dialogue tagging? Dialogue tagging actually helps in interpreting the natural language input at the utterance or sentence level. Several annotation exists. Map task annotation scheme that contains 12 tags for different moves for the map task data set. Then the damsel annotation scheme, which comes with 42 dialogue tags, and we have used this one. And then the ISO standard annotations scheme, that is a kind of universal annotation scheme that is used with 9 dimensions. We adopted damsel annotation scheme due to fine-grained and detailed dialogue classes it contains that we are interested. So the traditional approaches that are used to predict dialogue tags for the conversations or utterances are hidden Markov model, condition random fields, or Q-based models, and then neural networks. All these approaches either use the full 42 dialogue tag set or utilize the most frequent dialogue acts like statements, agreements, or declarative statements. So the overall goal of these approaches is to improve the overall accuracy over a general dialogue tag set. And our purpose is to look on rare but particularly useful phenomena in natural conversation, useful for dementia analysis in the light of conversation analysis studies. For this purpose, we are intending to build a dialogue tagger with those rare classes with the aim to determine by using the contextual information with of the current utterance in terms of previous utterances and previous dialogue acts can improve the accuracy of those rare classes or not. So and after this, utilizing those dialogue X sequences with other dialogue interaction features to differentiate between AD and non-AD patients. So we use two corpora here. One is a switchboard corpus, and the other one is a clinical conversational style dataset, that is Carolina Conversation Collection, and we use 30 conversations from this dataset. So for the annotation scheme, we adopted damsel tags at notation, and we take 17 tags of our interest that are shown here in table 1, and the two new tags are introduced here. One is the clarification request, one is the statement answers. As the Carolina's dataset is not available in with the dialogue X tag, so we manually annotated the conversation with these tag set and transform the switchboard dialogue X corpus from 42 tag set to 20 dialogue X tags. And here you can see this is the distribution of percentages of these dialogue X in switchboard corpus, and this is very less as compared to the other, and we rest of the utterances we have converted to the with the label with the other tag. So here is our approach, and our baseline is the bilateral model with lexical information from current utterance without any kind of previous interest. So from the utterances, we extracted the vector representation of using different embedding scheme like Elmo embedding and glove embeddings, and then these vectors are fed to the bidirectional LSTM, which produces the hidden sequence representation of these words, and then attention mechanism is applied, which summarizes the hidden vectors at the utterance level, and these representations are then combined with the previous utterance representation, the previous dialogue act, and which are then fed to the left to right LSTM and at the higher level to predict the dialogue act tag for the current utterance. And here particularly we use a context window of up to 3 preceding utterances and dialogue acts. We evaluated our model with both on switchboard corpus and Carolina's data. And due to imbalanced nature of these dialogue acts, we evaluated with macro average precision recall and F1 scores. So here are the results with different contextual settings of our model. So you can observe with the baseline model, the accuracy, and when adding the context of one utterance, the accuracy on the switchboard corpus is improved. And when further improving the dialogue act tag, it further improves the overall F1 score. Same is the case with the recall. Here overall it can be seen the switchboard F1 scores are higher than the Carolina's corpus scores. So at the bottom is the comparison of model of our model when we are using gold standard dialogue acts as a context, and when we are using the predicted dialogue acts as a context. So we can see when we are using the gold standard dialogue acts, the F1 scores are higher as compared to when using the predicted ones. However, these can be improved when using the longer sequences. Here we try to capture the effect of contextual information on some of the classes of our rare dialogue at tag set. So you can see here the recall score when we are using no context are around 0.2 or 3 or 0.24, and when we are adding one utterance, it's increased, and it's further increased around 80% when we are using one utterance and one dialogue at tag. So these are the score on the Carolina's data, and same are, and here we can see that some of the classes are greatly, the results are greatly improved when adding the contextual informations, particularly response categories in response to question types. So after looking at performing some error analysis, we have seen and observed that some utterances data QC utterances are misclassified with QW and BR tags, like doing what is somehow kind of labeled predicted with the QW tags. So however, by adding the contextual information improves the accuracy of this class. So similar, the poor recall values for declarative WH question. And we also observed that few forms of back channel that are present in Carolina's dataset, but they did not occur in the SWDA switchboard corpus dataset and are missing in from the training data. So after implementing and getting those dialogue act tags, we tried a different combination of features from these and for a downstream task of AD diagnosis. So different combination of features are tried here, like unigram dialogue X sequences and bigram dialogue X sequences. A question asked by a patient and a signal non-understanding by a patient, or a question asked by a interviewed and a simple yes answer responded by a patient. So the confusion ratios and question ratios, and then other interactional features like speech rate and overlaps, etc. So we use these features and trained a traditional SVM classifier on the Carolina's corpus and evaluated with a leave one out cross validation. So here we can see that, like, with only using the dialogue X tag, unigram dialogue X tag, we got an accuracy of 0.65. But when we added the bigram sequences of these dialogue X and the confusion ratios and question ratios, the accuracy is improved to 70%. And when further adding other interactional features like speech rates and turn durations and overlaps, it's improved to 80%. And here we can see that the F1 score for particularly AD class is 0.82. Overall, we can conclude that our proposed model utilize minimal contextual information of few preceding utterances, and dialogue X give better performance when compared to using no context or longer contextual information. So these rare class dialogue X sequences shows good potential as features to distinguish between AD and non-AD patients. And in the future, we are aiming to further improve the accuracy of these classes by combining lexical aspects of conversation with acoustic features. And we are also looking for newer data sets containing conversation of AD patients at earlier stages, as this data set contains the data of patient data at their moderate stages. Although this have a drawback, but it still contains conversation that are less structured and contains free conversation style rather than more formulaic tasks like containing in dementia bank data picture description based on specific tasks. And thank you so much and welcome to the question answer session.